Hi, I'm Dr. Tish with our mid-minute question of the week. This is probably one of the most common questions I get asked every tour at clinic. I'm in my 50s. What's considered a normal testosterone level, and when should I be concerned? Well, the answer is really there's no set answer for that. And so what's normal for you? So really we want to step back and say, are you having any symptoms? I mean, like fatigue, weight gain, moodiness, or muscle tone? Those are things that really we can identify because there's a wide range of lab numbers and people feel best at different ones. So you could take, for example, a test level of 500, which is mid-range. Some guys feel like they're half dead at that level. They just have no energy. Others feel amazing. So you can't really say that these levels are where it should be is normal. It's like shoe sizes. Everyone has a different one. They're not right or wrong. Now, what we want to focus on more is symptoms and symptom treatment. And so really one of the things that we see as people do get older, or even just really from exposures and stuff, is people's levels drop. And then they gradually start becoming more and more symptomatic until the point where they go, I need to do something about it. The biggest ones are lack of mental clarity, maybe even becoming forgetful, moodiness, low energy. And that's one that is the most frustrating for people, that their energy levels are much diminished, and things that they used to be able to do now they just can't do. They don't want to do. People even tend to withdraw. They don't want to go out. They don't want to hang out with anyone. They're just kind of retired. That's usually the tipping point. Now, sometimes people come in much sooner than that, but those are some of the big ones. Weight gain is another big one for men, and that's really the jokes were all made about the dad bod, but there is really truth in that. And that when guys become symptomatic with their lower levels, their muscle tone goes down, their muscles don't burn as many calories, and they almost always gain weight. And so it becomes almost difficult to lose weight, because really things that you would want to do is exercise more, but that requires more motivation. And people with low testosterone typically don't have much motivation. They're just trying to get by. So if they could muster up enough motivation to go work out, they typically don't have a good response from working out. The muscles don't respond. So it becomes frustrating. So we want to then put people up in the optimum level. There are some ranges where we shoot for when we have someone who is symptomatic and try to get them up in that range. And that's kind of a starting point for most people. After we start them, treat them further, then we reassess. Did we accomplish what we want? Did we get you to where you're feeling good? Not do we set a number threshold. That's not really where you're treating. We're not treating a number. We're not treating a lab value. We're treating the person. So each person is different. Each person requires different amounts. And so that's really our main goal. So I guess all the way back around to the original thing, what's a normal level? It's really what's normal for you.